and welcome back. This is the third segment, so to say. Yeah, Gerard ran them earlier on with Doctor, and with me right now, I have two very special guests in the studios. First of all, I would like to introduce Azizah Ali, who is the General Manager for Small Mid-Market Solution and Partners at Microsoft Malaysia, and Keegan Flynn, the co-founder of Doctor2U. Welcome to the show, guys.
Thank
you very much for coming this particular afternoon to share with us a little bit about this app, Doctor2U, right? And Keegan, I understand that you came on TV before and you were speaking to us about the app previously.
Correct.
That was prior to the Microsoft partnership, am I right?
That's correct.
Okay, so maybe you can just give us a bit of a refresher, and then from then, October then, when you came into the show to tell us about the app till today, what has been, what was the progress and things that are happening right now? I heard you added a lot of new features into it, right?
Correct.
Yes.
Correct. So Doctor2U is a mobile health app that was founded in October 2015 as a product of BP Healthcare Group.
Okay.
So we have a range of on-demand healthcare services. Our core feature and our first feature was an on-demand doctor house call feature where you can press a button and get a doctor to your door within 60 minutes.
Right.
So our model is essentially like Uber healthcare.
Right.
And since then, we've added a few new features. So we have a free live chat feature where you can chat with a doctor for free.
Right.
We have a video consultation feature that lets you video call with the doctor.
Right.
And we also have a medication delivery service that you can order prescription medications right to your home.
Okay.
Yeah. So and I think I went over this a bit back in October, but there are a few kind of big problems that we're trying to solve with this app.
Yeah.
So the first one is kind of the general inconvenience of going to see a doctor.
Right.
So you have to drive to the doctor's office, wait in traffic, park, wait in a waiting room for 20 or 30 minutes just to see a doctor for 5 or 10 minutes.
Yes.
And most of those appointments need to be during office hours, which means taking time off work, issues with childcare for people with children, and generally just an unpleasant experience.
Okay.
There's also just not a lot of options for urgent care. So if you're sick in the middle, if you're sick in the middle of the night, really your only option is to go to the hospital emergency room.
Yes, that's right.
So our service is 24/7. You can order a doctor at any time. And kind of one of the biggest problems that we realized we were solving over time is getting care for elderly patients.
Right.
So a lot of these patients have long-term chronic illnesses, and it's very difficult to transport them to a clinic or hospital. So
yes, so it's easier to bring the doctors
absolutely.
over.
So we can bring affordable, convenient home care services right to their door.
Right. I think back in the I do not know about much in the US. I only seen this from the movies. But back in the US, right, there are doctors that are going over to your homes to take care of you. Back in the days, 15th, 16th century, 7th century. But it doesn't happen here. Over here, we go to the doctors, am I right? It goes to the nearest clinic, goes to the nearest community clinic. So essentially, you are just doing something that is old there. Then you have to call, get somebody to the town, to get a doctor to the house, and usually it's supposed to be like from a wealthy person, am I right? Yes. So, bringing a doctor back to the home, what would be the cost like? The acquisition cost for the doctor to come over. Would it be more expensive, or would it be at market rate?
So interesting point about the history of house calls too, and I think you were right on. In the U.S., house calls used to be very common back in the 50s, but I think even in Malaysia, they used to be common, and now they make up less than 1% of doctor visits. And I think that's kind of unfortunate because there are actually a lot of benefits to house calls, and the first one is cost savings. So you're asking about the cost. So ours is flat rate of 200 ringgit during the day, 8 a.m. to 8 p.m., and 380 nighttime, 8 p.m. to 8 a.m.
Okay.
So that includes the doctor's transportation, consultation, 3 days basic medication, and they can also issue prescription, MC, and referral letter if necessary.
Right.
So obviously that's more expensive than walking down to a clinic on the street, but it actually saves a lot of money for our key market and the healthcare system in general, because as I said, a lot of our patients are elderly, over 65 years old, and to transport these people that are bedridden to a clinic or hospital is really expensive and really time consuming.
That's right.
And a lot of people since they have to make the judgment calls themselves on whether their family members are sick enough to admit them to a hospital.
Right.
It ends up making their symptoms worse and making really expensive hospital bills down the road.
Right.
So we give people the option to order a doctor to their home to have more preventive health care and keep these people out of the hospitals and those expensive hospital bills down the road.
So other than solving the doctor coming to the home, right? What else do you see that is an issue in Malaysia that you guys are working on to solve, other than having a doctor come over?
Yeah. So one of the really exciting new features that we're working on right now is an ambulance feature.
Okay.
So that will be launching in the first week of June.
Okay.
And we're actually using, so to go into the Microsoft part a little bit, we're actually using some of the features of the Microsoft Azure platform, which is what our app is hosted on, to allow for patients to see the real-time location of their ambulance.
Whoa, okay.
So this feature will basically be like Uber for ambulance.
Okay.
You press a button, the ambulance will come to you, and then we'll show a list of the top 5 hospitals that are closest to your current location.
Right.
So if I were to ask you right now what the closest 5 hospitals are to this location, you probably wouldn't know. I definitely wouldn't know.
Okay.
So we want to make the entire process as seamless and efficient for everyone to improve response times and also offer the best quality equipment and personnel.
Okay.
Because the current 999 system is very inefficient and can take up to an hour for an ambulance to come.
Right. That's what I heard. Because not only traffic is the issue, but it's also the issue of having the ambulance being around the area.
Yeah.
So how are you guys solving that issue? I mean, like, for example, if I call an Uber, I know this is just down the street, right? Or radius 5 kilometers away at least. So how do we know there is a radius of ambulance around the corner?
Yeah. So one of the biggest issues with 999 is that the entire process is manual. So if you get sick, or if someone needs an ambulance, you call 999. You tell them your location.
Yes, that's right.
They write it down. Sometimes write down the wrong location, and then they'll dispatch out to an ambulance provider that might not be the closest one.
Right.
They might call their friend, or they might call the company that they like the best.
Yep.
And then while you're waiting for the ambulance, you'll be calling them up and asking, and they might say, oh yeah, 20, 30 minutes, but you don't actually know for sure. So it's very stressful and puts a lot of stress on the families and the patients. So with ours, everything will be automated. So we're actually partnering with one of the top ambulance providers in Malaysia. So they actually keep their ambulances in all the hotspots around Klang Valley, where the biggest volume of people and the volume of calls come from, so that they can dispatch the ambulance as soon as possible.
Right.
And with our app, they'll be able to know the location of the patient as well as all the drivers, so that they can send the closest ambulance to that patient.
Right.
And everything's automated through Waze and Google Maps, so the driver will automatically be directed to the patient's location and then to the hospital to cut down on any traffic time,
times
things like that.
and all those kind of things, right? Okay, that's awesome.
Yeah.
So tell me a little bit about, from your side. We'll come to you later on. Okay, tell me on your side, right? The technology behind. You have features, but there's something powering those features.
Absolutely.
So your features, the company that you chose obviously is Microsoft, but of all the other companies out there, why them?
So our app is hosted on the Microsoft Azure platform, which is Microsoft's cloud computing platform. Microsoft is one of the oldest and most well-established technology companies in the world. Yeah. So we wanted a partner that was not only has the best technology, but also kind of the experience and personalized support to help us kind of bring Doctor2U to a new level. Okay. So we've been working very closely with the Microsoft team over the past few months, and they, from a tech standpoint, they work very closely with us. They hold IT workshops at our office, and they're always a phone call away. Okay. And that's really something that you can't get with any other provider.
Right. Okay, we're going to give you a pause and we're going to come to Azizah first.
Please.
Okay, maybe you can tell me about the Azure. Azure, right? If I'm not mistaken. Azure, sorry. Additional Zeng. But maybe you can share with me a bit about the Azure. What is that? And why are companies like Doctor2U using them?
So maybe before I get to that, I'll just talk about why we partner with BP Healthcare on the Doctor2U. If you look at in terms of the innovations, they have a traditional healthcare solutions before, and their visions in terms of how they can actually enhance that services, bringing it healthcare to your door and improving in terms of the service. So that's the visions that they have. So to Microsoft, that's a resemblance of how every single industry and every single organizations need to look at in terms of, I do have a brick and mortar services that I provided today. How do I deliver those services differently today in a slightly different world today, which is actually a world whereby the accessibility of the services is feasible via your mobile devices. And the world that can actually be powered by the cloud computing. So our cloud computing just now is actually an Azure cloud platform. So think of Azure cloud platform as an intelligent cloud, which is actually literally a whole bunch of servers that you can actually get access to at a very affordable price, because it is pay-per-use model. If they require only 5 servers or certain computing powers, they just pay for whatever that they actually need to use. And when they expand, be it expanding in terms of the number of new features and functionalities, they just add on those very fast. And if they expand across the countries, which is in the Doctor2U case, it will be expanding to Singapore, Philippines, and so on and so forth. It's very easy for them to actually be able to expand on that same cloud platform services.
So the services that you provide, basically, maybe we can just break it down a little bit. Because when we talk about services, we talk about a bunch of servers, but what does this bunch of servers actually do?
So maybe I'll just classify it a little bit. So the first level of the services is literally just the virtual servers.
VPS.
Right? So just the intelligent servers, just the physical servers. The second part of the services is in terms of our software as a service. That's actually software as a service. The third is actually a little bit more technical, is platform as a service. That means that when they actually develop something, they can actually leverage on some of the key modules or development platforms that's already on the cloud services. And the other elements, which is the fourth layer, is literally in terms of the artificial intelligence or advanced workload that we actually have on those intelligent cloud. And those are some of the capabilities that Doctors2U leverage on today. And imagine that these are the innovations that's actually Microsoft investing billions of dollars on annual basis. And the enterprise, be it small or big, are accessible to it on a pay-per-use model. So that's I would say, the power of how it could actually enable the organizations like Doctors2U.
All right, we're going to take a short break, and then when we come back, we're going to talk a little bit more, because we're just at the question 2 actually. We're just at question 2. So we're going to talk a little bit more about the services, and of course how it can actually not only power apps like Doctors2U, but how can you help the other industries as well. I'm sure that you have a lot of applications for other things as well, right? All that and more after the break. Stay tuned. Okay, welcome back. We were at the topic earlier on. Oh, sorry. With me is Azizah Ali from Microsoft and Keegan Flynn, the co-founder of Doctor2U. We were earlier on talking a little bit about Microsoft services. We have the VPS service, we have the AI service, we've got also server hosting services or something like that, right? Yes. Okay, so I'm more interested in the AI part, because I think that's really new as well, right? Maybe you can share with us a little bit.
Yeah, so within the artificial intelligence, we do have about 26 cognitive services that can be leveraged on. So one of it, for example, if the speech recognition, facial recognition, right? So some of the organizations are using it to actually improve in terms of the security. So giving an example, actually Uber uses Microsoft artificial intelligence in terms of the facial recognition, so that when you actually book the services and when you go into the car, you know exactly is it the right driver that you're getting yourself into. So it does improve in terms of the security functions of your own applications. And Doctor2U also in terms of the moving forward will actually leverage on some of those technologies. So the other one that probably I will touch on is in terms of part of the advanced analytic, not necessarily the artificial intelligence, is in terms of the business intelligence or business insight, the data side, right? Which is actually super critical because now the data is the new currency of the world, right? So within the advanced advanced workload of Microsoft Azure services is a business intelligence. And so I give you an example, the local company, which is Nando's, they're actually using it to improve in terms of their branch efficiency. So on a daily basis, the branch manager will be able to get the live data in terms of the trendings of what is most selling and how do they then link it to their stocking so that it does a lot of things doesn't go to waste. So that's an example of how exactly they use not basing on the past assumptions, but it's actually the live feeding of the information
on a daily basis.
Not just daily, it's on an hourly minutes basis as
it's live,
it's live. It's actually live. And imagine some of the retailers is actually on the FMB, whereby they do not want to, all their stocks is actually perishable. And they have to make sure that they actually have the live information for them to be able to be efficient in running their business. So that's an example of how organization can use some of the services within the cloud services to actually improve not only on their operations, but also in terms of improving in terms of the wastage in order for them to be more profitable.
Which are the industries that you think will benefit from this the most?
I don't think there's a single industry that I can call out. So we have so many of the examples of the industries that's actually taking advantage of the advanced analytic. Within the advanced analytics is also the Internet of Things in terms of the reporting side of it. And imagine the the manufacturing or even the building maintenance. So that's another area whereby we partner with UAM Agenta, whereby they release in terms of their new smart building management for them to be able to actually monitor in terms of the temperature and the chillers and so on and so forth, to be efficient in their maintenance and operations. And we also partner with, so there's so many industries, the airlines industries is with Rolls-Royce, for example. So there's so many of the industries that take advantage of it. The smallest, as I mentioned, for example, as small as Nando's, right?
Nando's not small.
Nando's is not small.
It's small to Microsoft, maybe.
So maybe I'll give an example of the smallest.
The smallest you can think of.
The smallest, which is actually this very small company called Keegan Berhad. And they actually provide the food coloring. So, and they are at 70 years old setups, right? And you can see that even as company as small as that, they do realize that they need to actually improve in terms of how they manage and operate. And they do leverage on Microsoft cloud services for them to actually be, and of course it varies in terms of what they leverage on. For them, they actually leverage a lot more in terms of the Skype for business, for them to actually stay connected with their customers, right? So, and
I forgot Skype was acquired by Microsoft. Because I use a lot of Skype.
So we have the very wide ranging of the cloud services.
All right. I think that's all the time we have for you today. They say got another 2 minutes, man.
So maybe we want to hear a little bit.
We want to hear a little bit from testimonial from Doctor2U, right?
As well as the roadmap that Doctor2U has in leveraging on Microsoft cloud services.
I think
got 2 minutes, dude.
I think we've touched on it a bit already, but we're planning on really leveraging on the AI side from Microsoft. So we've already implemented some of it into our current chatbot, and we'll be constantly improving that with the help of Microsoft. And to your point about big data, we'll also be using Microsoft's AI to help analyze all the patient behavior and patient outcome data in order to help our doctors provide more effective treatment plans for our customers.
I think it's not only that, it's also the type of services that is needed around. You also can find out like what's really needed by the market, and what diseases that you're treating, and then generally
and providing data to governments, insurance companies, pharma companies.
Correct, and then you can solve the bigger issue instead of a smaller issue. Right. Thank you very much, both of you, for coming on the show, sharing with us a little bit about the entrepreneurial. I think it's the entrepreneurial services that is provided by Microsoft. I know we don't hear this on a daily basis. A lot of us whip out our phones and just use the app, not bothering how it works on the back end. And here the two industry, I say pioneers or experts, they're coming to talk to us a little bit about this technology that you are using at your convenience. All right, stay tuned because we've got the news updates up next right here on Bernama News Channel.